Hi, I'm Dr. Brett Langston. I'm the prosthodontist and the owner of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia. And I'm here to help you watch your mouth. When it comes to flossing, people always want it faster, quicker, easier, more convenient, which I get. They don't want to sit there for 2 minutes and floss. So one product that a lot of patients have are these dental flossers that have a plastic handle. There's lots of different shapes and sizes, and a straight piece of floss that goes across the middle. These are really good for getting out debris right after a meal. If you have something stuck in there, it's great for isolated incidences. The problem is you're not able to break the contact between the teeth and then hug each tooth individually. So we see a lot of tissue laceration, we see a lot of tissue damage because unfortunately the only mechanism of action is to just go vertically straight down. And so a lot of times, while it does a good job of dislodging any trapped food particles, unfortunately it does damage the tissue. So if you have bone loss, tissue loss with gaps or spaces next to the gum line, what I would recommend is something along the lines of this product, and there's lots of different brands, that basically is a little tiny handle with a straight tufted end, I guess, if you will. So you can go in between the teeth, kind of underneath that contact spot. So you can floss in between the teeth and then go back with this guy, and that does a really good job of cleaning off next to the root surfaces, cleaning off next to those little concavities that a piece of floss isn't going to get to. Okay, so this is a zoomed in example of an interproximal brush. And so basically it comes with a handle and then it has a tufted end, and they come in different sizes. So if you have, really healthy teeth with lots of tissue filling those gaps, they've got a real small narrow point. And then also for our patients that have periodontal disease with bone loss and larger gaps between the teeth, these brushes can go up to extra wide. And so go down the aisle, the toothbrush, toothpaste aisle, there's lots of different sizes. We give these out to our patients a lot because they really help with home care and dexterity, and you can bend the tip. So if you have an angle you're trying to get into, really handy. I highly recommend these as well. So one of the questions that we get a lot is, what order should I do all this home care regimen? For me personally, I like to brush first, then floss, and then use mouth rinse, because I feel like brushing, you remove a lot of that debris. Flossing, you get in those areas where the toothbrush can't quite reach. And then the mouth rinse cleans everything away, leaves you with a nice fresh breath feeling. There's really not a wrong way. I think if you want to floss first and then brush, that's awesome. We love anytime you floss and add that into your regimen, that's great. Personally, I would probably go with the mouth rinse last, because you clean off all the debris and all the extra material that you've kind of knocked off the teeth, and it leaves you with a great fresh breath. I'm Brett Langston. I'm here to help you watch your mouth. I'm Brett Langston. Thank you for letting me help. God. I'm Brett Langston. Thank you for letting me help you watch. God.